Most common pediatric tumors or pediatric cancers are hematological malignancies or hematological cancers. When we say hematological, that means related to blood or blood products. So any cancer which is arising from blood or blood products are called hematological malignancies. And these typically are leukemias or lymphomas. So leukemias are commonly described as blood cancer in common parlance, are probably the most common malignancies in the childhood. Apart from these, brain tumors can happen. I mean, tumors can happen in any part of the brain, which can cause a significant amount of morbidity or significant amount of suffering for the child. But most of these cancers, both hematological as well as brain tumors in childhood, they are highly curable. The cure rates are above 85 to 90% in majority of these two common tumors in the childhood. Apart from these tumors, we also see tumors like sarcomas, that is tumors of the soft tissue. They could arise from the bone, they could arise from a muscle, they could arise from an organ. Apart from these, we also see something like a Wilms tumor or a neuroblastoma. Wilms tumor are very common tumors of childhood arising from kidneys, and neuroblastoma is a very common tumor arising from a nerve tissue, which is more commonly seen in the abdomen in children. So if I have to generally classify pediatric tumors, I could classify them into solid tumors, tumors arising from an organ or a solid structure, or hematological malignancies arising from the blood or blood products. So majority of these pediatric cancers which happen in India are curable. They are curable in a multidisciplinary setting. That means multidisciplines, meaning that the child has to undergo surgery, the child has to undergo a set of chemotherapy cycles, child has to undergo radiation. So a combination or a combination of all three or combination of two modalities of treatment is required in majority of the cancers, and they lead to good high chance of cure.